Hi, folks. We will get started in about 1 more minute. We're just giving folks who are in the waiting room a chance to get in and get settled. We invite you to read this slide, and I'll narrate it. Well, someone else is going to go over what the details are, but just know that there's ways that you can increase your accessibility and your functionality. If you have any problems or any special requests, you can pop them in the chat right now, and we will get started in about 30 seconds. Okay, well, we have a critical mass of folks here. I am Tammy Govea. I am the director of the Center for Innovation in Social Work and Health at Boston University School of Social Work. And so excited that you have decided to spend an hour and about 15 minutes with us this evening to learn a little bit more about the role that social workers have in voting for health and voting for social determinants of health and combating disinformation. In our first series that we're calling From Ballots to Better Health. This is the first in a 3-part series. You'll learn more about the other 2 sessions later on tonight, but just wanted to first welcome you and welcome you to our panel. And first want to start off with a land acknowledgement. Mitra, if you can advance the slide, please. Great. So just want to acknowledge that Boston University is located in Boston, Massachusetts. I know that we have folks joining us from around the country, so welcome. Thank you for being here. But for us in Massachusetts, just want to acknowledge the fact that the land that BU occupies once was home of the Wampanoag and Massachusetts people who stewarded the land and prospered from her gifts. These people were forcibly removed and enslaved through colonial acts of terror, perpetuated by white settlers from nations seeking to extract and exploit the gifts of Mother Earth and the labor of her stewards. The deleterious effects of these acts have impacted generations of people and the land itself. Patterns of violent oppression-fueled racial capitalism will persist until we address the root causes. Neither the planet nor its people will find peace. As social workers, we have a moral obligation to name injustices, to resist oppressive structures, and to build relationships that catalyze the collective action. So right now, I'd like to turn it over to Diane Crowley to talk a little bit more about why we're gathered here today to address issues related to health equity and voting for health. Thank you.
Thank you, Tammy. Good evening. I'm Diane Crowley, and I'm the director of the Fall River Off-Campus program here at the School of Social Work, and I coordinate the school's BUSSW Votes initiative. Our program is a collaborative of students, faculty, and staff aimed at facilitating voter registration, advocating for voting rights, and working to ensure a safe voting practice within our school community. Teaming up with Vot-ER, the Center for Innovation, Social Work and Health, and Voting is Social Work, the USSW Votes endeavors to engage students, faculty, staff, and partner agencies by raising awareness about the significance of voting and its integral part of social work practice, to educate students and partner agencies on voter engagement strategies and voting rights initiatives, and to register students, faculty, staff, partner agency, colleagues, clients, and communities to empower them with the ability to vote. And finally, to ensure that all individuals served by social workers have the equitable access to voting. The USSW Votes promotes nonpartisan voter registration and engagement among social workers, underlining the importance of adhering to the NASW Code of Ethics, particularly Principle 6 regarding social workers' ethical responsibility to the broader society. This principle emphasizes social and political action to guarantee equal access to resources, services, and opportunities necessary for individuals to meet their basic needs and thrive fully. And we encourage and advocate for social workers to engage in policy and legislative changes that address social inequities. It's my pleasure to welcome you here tonight to our first in a series for ballots from ballots to better health. And tonight's presentation is combating disinformation and voting for social determinants of health. And before turning it over to our first speaker, I'm just going to tell you a little bit about some housekeeping things that need to be addressed. So first, please watch the chat for links to resources as we go through the presentation. Please use the Q&A function for questions. Questions will not be anonymous, and questions will be sent only to the host and the co-host, and we'll read those and respond to them without naming the questioner. And we will provide 1.25 CEs to those who complete the post-event quiz within 7 days and earn at least 70%. And finally, we ask that you adhere to our nonpartisan statement of participation shared previously. And now allow me to introduce our first presenter, Vanessa Navarro. Vanessa graduated with her BSW from St. Leo University in May 2023. She's completing her MSW at Boston University with an anticipated graduation date of August of 2024. Ms. Navarro was involved with the Campus Voter Project as a Democracy Fellow and brings a passion for civic engagement into her practicum at Vot-ER, a nonprofit organization that helps to integrate civic engagement into healthcare. These channels provide her with relevant leadership opportunities and up-to-date policy and advocacy information regarding voter initiatives. And it's my pleasure to welcome Vanessa and have her share some of what she's learned at Vot-ER and what she is going to be able to teach us all about this evening. Thank you.
Hi, everybody. Just waiting for my slide to come up, but I always get a little nervous when people start talking about me in such a nice way. But I did want to thank Tammy and everyone at BUSSW for having me and letting me talk to you guys about the social determinants of health and voting. Like Diane said, I am an MSW student here at Boston University, and my placement is at Vot-ER, which is a nonprofit organization that looks to implement civic engagement in healthcare spaces. I initially got involved with Vot-ER during my undergrad, where we utilized Vot-ER's tools to develop voting registration drives on campus through Vot-ER's Healthy Democracy campaign. I've learned a lot about the importance of voting and the links between voting and health, but more so than that, I learned that social workers can play a big part in turning non-voters into voters, promoting client autonomy and empowering communities. But before we get to that, I will talk a little bit more about the link between voting and health. The reality is, a lot of healthcare outcomes are determined by non-medical factors. Access to food, transportation, and affordable housing affect our well-being. My field placement at Vot-ER has an origin story that offers a really powerful illustration of this truth. Vot-ER was started by Dr. Alistair Martin in 2019. Dr. Alistair Martin is an emergency room physician at Massachusetts General Hospital. One cold Boston winter evening, a woman came into the emergency room with her 2 young children. She explained to Dr. Martin that she had just recently moved to Massachusetts with a partner who she was now attempting to get away from due to experiencing intimate partner violence in the relationship. She had been sleeping with her 2 children in her car because she wasn't sure where else to go. And she told Dr. Martin that she looked in the back seat and saw her youngest child shivering and knew that she could not stay another night in her vehicle. So she came to the hospital. She told Dr. Martin that they were cold, hungry, and needed help. When faced with this dilemma, Dr. Martin called the on-duty social worker. The social worker explained that Massachusetts is a right to shelter state. This means that if you are an eligible Massachusetts resident and you have children, you cannot by law be left out in the cold. But because this mom had just recently been brought to the state, she was unable to provide the documentation needed. When Dr. Martin explained this to the social worker said, no problem, we can register her to vote in order to establish residency if that's something she's open to. So when Dr. Martin went back to the mom and asked if she would be interested in registering to vote, the woman said, no one has ever asked me that before. I didn't know that that was something that I could do. And that was a light bulb moment for Dr. Martin and the inspiration behind Vot-ER. So what that patient was experiencing with Dr. Martin was a health-related social need. And what causes those are the social determinants of health, which are the underlying community-wide social, economic, and physical conditions. But we can't begin to address the social determinants of health until and unless we begin to address the structural determinants of health. So the causes of the causes. Why is it so difficult for people to get a job in certain communities? Why is it getting harder to pay rent and get access to quality food? When you zoom back out at these social determinants, they are caused by a myriad of factors: social, political, environmental, and various others. A good way of looking at this is thinking about it like a stream of water. Upstream structural determinants are the policies that our elected leaders put into place. These can lead to health inequities that are often referred to as the root causes of a lot of health issues. Medicaid expansion is one example of a policy that might be passed by elected officials in our state government. Social determinants are the results or downstream effects of the structural/political determinants at the top of the mountain. These are the conditions and environments that people live and grow up in. Going back to our example of Medicaid expansion, we can think about the access to affordable health insurance coverage that may or may not be available depending on a state's expansion or non-expansion of Medicaid eligibility standards. Ultimately, the downstream effects of the structural determinants are the health outcomes of our clients. Chronic pain as a result of untreated illness from lack of insurance coverage and affordable care options is one example. So in order to prevent negative downstream health outcomes, we need to make sure that the voices of the communities that we serve are being heard in the democratic process. So let's take a look at the connection between voting and health in communities. So I am not a native Bostonian. I'm from Tampa, Florida. So I just recently came here. So I was not very familiar with Mattapan, Boston. And if you're not also familiar with it, it is a neighborhood in the Boston area. And this has a large Black and Caribbean population. And it also has a lot of immigrant-owned businesses. In 2013, Mattapan had 24% lower voter turnout rate compared to West Roxbury, a nearby Boston neighborhood. Mattapan also had a life expectancy rate that was 5 years lower than the state average in 2015. Right now, we're also going to take a look at Southwest Detroit. Here in this area of Southwest Detroit, there are over 24 industrial sites. Residents have a life expectancy 7 years lower than the rest of the US, and asthma hospitalizations are 2 times the rate of Michigan's and 5 times the average rate of the United States. Here you can see the relationship between health and voter turnout. There are over 4,800 election precincts in Michigan, and 41 of the 100 lowest turnout precincts are in Detroit. Of those, about 19 of them are in Southwest Detroit. Southwest Detroit has a significantly lower life expectancy than other areas, significantly higher asthma hospitalizations, and significantly lower voter turnout rate than surrounding areas. And then when we pan out even further, we can also see this relationship nationally with the Healthy Democracy Index. States with less voting access have worse health, while states with more voting access have better health. So we see the problem, and it is a big problem. There are 72 million unregistered voters in the United States, which is approximately the size of the entire population of France. And if we look at the group of voters that are unregistered or unlikely to participate in the democratic process, we see that the group of voters shares an overlap with communities who have been historically underrepresented and under-resourced. These groups are most likely to interact with social workers at some point in their lives for a variety of reasons. Folks that are young, LGBTQ, low income, Latino, Black, Brown, and Indigenous. We know that social workers are developing a unique therapeutic relationship that allows us to serve as trusted messengers in regards to providing accurate information about civic engagement. And with that comes a great opportunity for bringing potential voters who otherwise would be excluded. And when our communities are excluded from the democratic process, not only are their voices not being heard by the politicians who are making decisions that impact their lives, but they are also being thrusted into a harmful feedback loop that undermines their self-determination and autonomy in the civic process. Political campaigns, like a lot of the services that we provide, operate on limited resources. That means that they have to strategically decide how to utilize their resources in a way that maximizes the outcome towards their goals. Their goal is to get people to vote for them, which means that they're going to use resources on voters that are more likely to go to the polls than voters that will take more effort to turn out, saving their campaigns money and time. For all the voters that don't get contacted by the political campaigns, they end up feeling 1, ignored, 2, unheard, and 3, apathetic about the political process. And they end up sitting out the election. And then as a result of this, they reinforce the political campaign's exclusionary practices in the following election years. And the politicians that end up serving as elected officials don't shape policies that reflect the needs of those excluded voters because they didn't hear from them in the first place. So how do we break the cycle? We break the cycle by helping people to vote, helping our clients to vote. We can promote voting, making clients more likely to vote, labeling them as likely voters. Campaigns will start making contact, and thus the positive feedback loop begins to take shape. And we already have promising indicators of success. A partner of Vot-ER's called Nonprofit Vote did this study where they promoted get out the vote efforts across 1,000 different nonprofits in 2018. They found when nonprofits reached out to their clients and patients that the folks who benefited the most were the folks who needed to benefit the most. Low-income patients and clients of color had dramatic impacts and had the largest turnout advantage. Look at what happens when you look at race. When a nonprofit reached out to Asian, Black, and Latino clients, they had dramatic improvements of voter turnout and the largest turnout advantage. Now look what happens when you look at age. When a nonprofit reaches out to clients and patients about voting based on their age group, young patients and clients tend to dramatically have higher turnout. So there is an incredible opportunity for us to change dramatically our relationship with health and voting in this country. So there are many tools that we can use to support our client in achieving the best outcomes possible, and voting is one of them. It's just one tool, but it's a powerful tool. Let's take a look at some of the research that shows that our communities are healthier when voters have access to self-determination, autonomy, and connectedness that comes from participating in the democratic process. In June 2022, the American Medical Association formally recognized voting as a social determinant of health. This study in the Public Health Review from a few years ago demonstrated that even when controlled for factors like income, inequality, and state median household income, people are more likely to self-report fair or poor health in states where there's a below average voter turnout. Here, a child development study shows that voting among adolescents was associated with less risky health-related behaviors and fewer depressive symptoms in young adulthood. One potential reason for this could be that voting presents an opportunity to exert voice, perhaps establishing a path to health through empowerment. This study in political psychology demonstrates that even after you control for all factors, race, age, political orientation, and education, those who were more politically engaged, those who registered to vote, those who voted, and those who have higher political activism scores also reported higher levels of personal well-being. And finally, a Journal of Preventative Medicine and Public Health did a study of 44 countries, and they found that voter participation was associated with better self-reported health, even after controlling for individual and country characteristics. People who vote feel a higher level of social connection and feel healthier. So where do we as social workers fit into all of this? Some of you might be thinking that bringing the topic of voting up with clients is not our place. But whether you practice at a macro, micro, or meso level, it is our ethical responsibility to do this work. On this slide, you can see where encouraging our clients to participate in the democratic process fits into our code of ethics. I did want to highlight one that I think often gets lost. Human relationships are the fabric of the shared communal power that is needed to address social problems from a grassroots level. Civic engagement offers human connection in a powerful, solution-oriented way. Civic engagement isn't just about an individual's relationship with the system that impacts them. It's about their sense of relationship to their community and the shared impacts and experiences, and their ability to create shared change for one another when they speak their truth within these systems. So, what are some ways that we can help? Vot-ER helps by equipping social work and healthcare professionals with tools to promote voter registration and education among clients and patients through initiatives like Vot-ER badges, Civic Health Month, and the Healthy Democracy Campaign. Vot-ER leverages the trusted relationship between healthcare providers, social workers, and their patients and clients to encourage civic participation. So I actually have my badge here. It is a really simple, nonpartisan way to get clients involved. What a client will do is they will scan this QR code and it will take them to a landing page where they can check their registration status, register to vote, request a mail-in ballot, and chat live with someone if they have any questions about voting. Vot-ER's badge is a great way for social workers to demonstrate their commitment to voting rights and health equity, as it provides a straightforward and nonpartisan method for registering patients and clients to vote. The program is completely optional, won't interrupt your workflow. Additionally, Vot-ER is politically neutral, meaning it won't promote any particular political agenda or a candidate. It is a great way to empower clients and help tackle the health disparities we witness in many spaces across America's healthcare. And you might be asking, is this legal? Yes, it is very much legal. The National Voter Registration Act of 1993 allows hospitals and social service agencies to facilitate nonpartisan voter registration for interested clients and patients. Because clients voluntarily enter their information using their own devices, these activities are not subject to HIPAA regulations. Nonprofit Vote has released a set of legal guidelines to help nonprofit organizations understand what they can and cannot do in regards to voting issues. 501c3 organizations may conduct nonpartisan voter engagement activities designed to help the public participate in elections such as voter registration, voter education, and get out the vote work. So I did want to give you all a few seconds to request a badge if you wanted to. They will mail it to you for free. So all you have to do is scan the QR code or put the link into your browser and it should take you to register for one. We can stay on the slide for maybe like 10, 15 seconds, if that's okay. Just to give people time to scan the QR code. And lastly, I did want to plug in Vot-ER's Healthy Democracy campaign. So the Healthy Democracy Campaign is a voter registration drive led by students in medical schools and other healthcare ed programs. So I took part of in the Healthy Democracy Campaign when I was getting my bachelor's in social work, and it was a lot of fun because it is a little bit of a competition between universities and colleges where they try to see who can register the most people to vote. And it's really fun when you're in a state like we had USF. I went to St. Leo. This was in Florida. And, you know, you just have some healthy competition between you and your fellow schools while also doing like civic engagement and registering people. And it is a really great way for social workers to get some organizing and policy practice. And I know BU wants to take part in this year's Healthy Democracy Campaign. It's in the fall. So if you are a BU student and you want to get involved and you'll be here, I'll put my email in the chat and you can email me or you can email Diane. And if you're not a BU student and you are or if you're a professor in another school, also feel free to email me. I can get you in touch with somebody at Vot-ER so they can talk to you a little bit about the program. And then you're also welcome to sign up for the Healthy Democracy Campaign at this QR code. But that wraps up my segment, and I will toss it to Tammy, who will introduce our next speaker and our next section.
Well, thank you so much, Vanessa, for taking us through that very quick overview of how social workers really have a role to play in working with our clients to get folks registered to vote. I really appreciate you starting with the background story of how Vot-ER started and taking us all the way through the ethical questions of why it's important for us to have a role in getting ourselves as well as other people registered to vote and engaging in our elections, and then also just taking us through how to get a badge and how to compete with other schools. We do have, you know, a lot of students here. We also have a lot of folks who are professionals in the field, and there's a lot here that you have shared that I think everybody can take a piece of and apply to their work or their educational environment. So really do appreciate you being here with us, and we'll come back to you in a little bit when we get to the time for question and answers. But for right now, what I'd like to do is turn it over. I'm going to ask Timothy to join us. Spotlight Timothy. And so would love to introduce Dr. Timothy Clancy. Really excited to have him here with us. Thank you for joining us, Timothy, to share your expertise. Timothy is an assistant research scientist at START. It's the National Consortium for the Study of Terrorism and Responses to Terrorism at the University of Maryland. And Dr. Clancy specializes in studying wicked mess problems, including violence and instability as complex systems. Timothy comes to us as a presenter today with over 30 years of experience helping stakeholders in all manner of organizations understand their wicked mess problems and work towards resolving them. His current research topics include understanding violent radicalization as a system, the terror contagion hypothesis for mass killings, and advanced methods for modeling social complexity through computer simulations integrated with AI. He is the founder of Dialectic Simulations Consulting, LLC, and he's also a writer and a video commentator, providing systems thinking and analysis on complex current events through his blog and YouTube channel. I love the name of it, called Info Mullet. Timothy also volunteers his time and his research efforts to help a range of community-based groups, such as ours here, understand and confront harassment, toxicity, and sexual assault as a system of interactions rather than isolated incidents. So we'll turn it over to Dr. Clancy, and then we will have time for question and answer. Thank you.
Thank you so much, Dr. Gouvier, and Vanessa, appreciate setting us up for this. To compare contrast how these two go together, when Vanessa is talking about that voting, getting the voting to achieve those social determinants of health, disinformation can be a friction that interferes in that. It's sort of like a barrier to get that. So what I wanted to do tonight is follow up and get at a very high level overview. I'm going to go through some materials of what is mismal disinformation? How does it work? How do we recognize it? What are the fundamentals of so we can understand better how to combat it? And then what you can do in your everyday communities. This is being recorded, so if there's any questions in what I'm going over, you can go back and happy to answer. But when we talk about disinformation, we're really talking about cultural scripts. And cultural scripts at a very high level is any way we communicate an idea. It can be in our personal networks, our communities, our professional settings, in between people, in the digital landscape, messages, symbols, videos, memes. These are all cultural scripts. And the cultural scripts of mismal disinformation are a type of cultural script that we recognize because we see every day, but we might not know the differences between those three types. So I like using current events and examples, and I'm going to use a very current event that happened with the NFL and Taylor Swift to go through examples of what mismal and disinformation look like. So malinformation is based on fact, but it's used out of context to mislead, harm, or manipulate. And here's a meme from early on. This is before the dating with Kelsey started. Taylor Swift, they were saying, oh, they're promoting her albums in the NFL. This is because they want her to sing at the Super Bowl. Not exactly super harmful, but it's the context is they were promoting her songs because she has one of the world's largest tours, and they were trying to get recognition for that. But it sets in place this kind of theory that there's conspiracies, there's secret efforts. It's sort of building a momentum. And when we get to disinformation, disinformation is deliberately created to mislead, harm, or manipulate a person or social groups. When we talk about how do we get those voting efforts to improve social determinants of health, disinformation can be a barrier or friction to that. And this is an example closer to the Super Bowl where Taylor Swift now has a clock, a piece of jewelry, an innocent piece of jewelry, but it has been attributed with sort of anti-Christian, satanic references. This is disinformation. It's clearly false, but it's playing on these conspiracy fears. Misinformation is false, but created or shared without the intention of causing harm. So this is kind of a funny meme that was shared after the Super Bowl or around that time, putting Taylor Swift in line with other traditional conspiracy groups, including, Long John Silver. But it's always important. There's just information, right? What actually happened? She was in the Super Bowl. She had a little bit amount of exposure, but we're often combating this mismal disinformation way in excess of what is actually occurring. That's the accurate. So when we think about how this leads to toxic radicalization, there's a miasma and a germ approach. And you think about miasma theory, this is what they thought in the 18th or 19th centuries, how people got disease. It was in the environment, it was in the air, it was the vapors. And when we think about the disinformation that inhibits those voting drives or those voting efforts or inhibits changes to social determinant, it's easy to think, well, there's mismal disinformation. It's in the air. It's in the environment. It just is. And people get radicalized, toxically. But the germ theory is that these are really distinct cultural scripts. Cultural scripts are the germs. It's an analogy. It's not, an actual, but cultural scripts, and they facilitate specific stages of radicalization that lead to these toxic behaviors. And just like a germ, once you understand the germ theory approach, you can diagnose it and address it. Now, we're going to go over these stages in the next slide, but radicalization moves through grievance, narrative, fixation, radical identity, and radical action. And it can be toxic. And we're going to use a toxic example here. Again, this is nonpartisan. So I picked an influencer who's overseas, doesn't have any political affiliation, but you all probably recognize and deal with his impact and the negative toxicity he spreads. And we can use this to demonstrate how disinformation fuels toxic radicalization. So I like to use the analogy of a tree. All radicalization starts with a grievance in the roots, and a grievance is not just it's not being upset at some random chance or an accident. It's the belief of moral outrage that some group out there is to blame for me not getting something, and it's or there's something in the way, and it's valid. We try and be very careful to say, well, you can't, don't try and argue someone's grievance. They may be experiencing it. There's lots of ways to interpret it, but I want to use this example specifically for the individual I'm going to talk about. In this research report that was released in 2018, there was this, and some of you may have seen this, it may have gone through, there was a report that men and women were having less sex in the previous year. And it was this large spike, and it created this whole, media storm. Are men not having as much romantic partners? Are women turning away from men? And this created an atmosphere within which, if you were a man in this age group, you might have a grievance that is expressed in two ways. The personal grievance. So personal grievance is something you personally experience. And it could be, something valid or something, we may say, hey, that doesn't make sense, but they're experiencing it. So personal grievance is that's me. But important to understand for disinformation, vicarious grievance, that could be me. Disinformation that targets vicarious grievance is targeting sort of extended humiliation on behalf of someone else. And this then fuels this desire for, well, who's to blame? But let's take a look at what happened when we play the tape out. This whole concern about, you know, whether people are having enough sex and all that, it faded off. It returned to natural levels. And this is very important. The grievance started in 2018, but faded away and has now sort of evaporated. But that grievance lingered and was taken advantage by disinformation that actually has a huge impact on SDOH. So the narrative, a conspiracy narrative, are these cultural scripts of disinformation that explain the grievance. The reason why you aren't being as successful as a man is you're not this alpha Chad, giga Chad, these concepts of can be very toxic, very misogynistic, right? And this is a conspiracy narrative that takes that grievance and then puts it in the context of women aren't responding to you correctly, or you're not the right type of man. There could have been other narratives, but this one becomes a very specific conspiracy narrative, and it fuels people who get engaged in this. They want to find out more, they get more context. Fixation is when this interest in a grievance and a narrative turns pathological, and it begins impacting school. And you may have seen, if you've worked with any young men or young adults, they've probably encountered this, where this consuming thing with the digital and into this space in 2018 in what's called the manosphere. Andrew Tate, as an influencer, became globally prolific, spreading this conspiracy narrative of disinformation. Now, again, I'm using this as a proxy, but Andrew Tate's message was this conspiracy theory of misogyny that, oh, it's not your fault, men, you can be better. What he's trying to get them to do is adopt this radical identity. He furthers something called Hustler University. It's an economic scam where he basically charges them $40 to go to a university that promises to solve all their problems. It doesn't really achieve that, but it, you know, gets money for him, and that's his thing. But the reason this matters for SDOH, and the reasons I'm using this as an example, is the conspiracy narrative. We talked, Vanessa was talking, it was a great analogy, structural determinants of health and social determinants of health. These conspiracy narratives target the structural pieces, and in this case, it's the misogyny. He's targeting and exploiting the misogynistic structures to exploit this, and that's furthering the barriers for advancing social determinants of health on a range of issues. This study was done in Britain, where they took children and exposed them to only 30 minutes of Andrew Tate's content, just 30 minutes. And only on 30 minutes of exposure, the children were 3 times more likely, you know, boys and girls and all genders, to say, oh, it's more likely you need to have at least one dominant person in the relationship. But they were 5 times more likely to believe that if you hit someone, it was okay if you apologize afterwards. So this is now showing how these toxic radicalizations can spread extreme harm in the social determinants of health space and create these frictional barriers. And I'll use this as a proxy. Maybe other disinformations, what they're activating people to do is to not vote or to suppress the vote or to avoid votes, right? This is how you can use this as a proxy to understand other forms of disinformation you're going to encounter. So how does this spread? Well, it's obviously shared through personal networks, but increasingly it's shared through digital landscapes. So broadcasting is in these large platforms that connect with hundreds to thousands, and broadcasting uses disinformation to shape the grievance. What should you be upset about? Is it personal? Is it vicarious? And that narrative, that conspiracy narrative, who's to blame? Who should you blame for this? But there's also a layer of digital space that is narrowcasting. These are servers, messaging apps, platforms where they're really having a more personal relationship. And this accelerates fixation by creating the belief that they're having a personal conversation. And this is where they fuel radical identity, radical action. And this leads to parasocial relationships, which is what Andrew Tate has sort of exploited. Was the people believe they have a he's out to help them, he's going to make them more strong or powerful. It's all sort of this disinformation, but these parasocial relationships can be very strong and then fuel this toxic radicalization. So how we receive these cultural scripts, it's very important. If you're going to combat it, you got to know, like, how do the germs get into us? Like, how does the germ reach us and infect us? Well, on the left are some generic cultural scripts. One's harmless, one's disinformation from someone we admire, and one's disinformation that maybe isn't very coherent, it's rambling. On the right is the person receiving it, the target of the audience that wants to receive it. And in between are these three filters. This is very key to understand if you're going to combat disinformation individually or as a group. The first filter is self-similarity, similarity bias. So the person on the right, let's call them purple, right? They have this grievance that is specific to them. They look for people that look like them, seem like them, act like them. They're going to only receive those cultural scripts that they see themselves in. So these cultural scripts come through and the first wave gets filtered out. If they don't see themselves in that script, it gets filtered out. The next filter is prestige or notoriety bias. This is where Andrew Tate is sort of plays the celebrity. I'm rich, I'm famous, I'm powerful, but he also exploits that he's being banned. He's been under criminal investigation. So he has a high notoriety bias. And that filters another wave. And then the final wave of filtering is it coherent? Can I understand what I'm being, what the information of the script? And this is how coherent scripts, this is all these filters occur. If you don't get through those filters, your message isn't getting through to that person. And this occurs in a large landscape of many cultural scripts. So let's take now, this is the digital landscape in broadcasting. We've got our scripts on the left, we've got our three filters, we've got our radicalization tree, and we've got our purple person, right? So when they begin going on the internet, if they're in 2018, they're thinking, oh, I saw this, not as many young men are having dates or whatever it is. Maybe I'm going to look out for some workout videos. I'm going to figure out how to make more money. The algorithm is going to direct them. It's going to take that response and direct them to a part of the internet that focuses on what they're asking. And in that spot are disinformation scripts. Those are going to come down and go through the filter, and that disinformation is going to begin filling that radicalization. It's going to tell them a grievance, and it's going to explain that grievance with a conspiracy narrative. It's going to give them the story to believe of why this is happening. As they begin engaging with it, this is where fixation comes up. The algorithm's now going to tailor it, maybe shift to the right, maybe reduce it, and now they're in the manosphere space. They're in Andrew Tate space. This is a smaller, more focused area, but it's much more dense in disinformation. And what happens is as they get fixated, more of these disinformation scripts come through and facilitate that radical identity, that radical action. And in addition to what harms them, they are now in this sort of overall effect, the social and structural determinants of health is going right alongside this. Now, the good news is there's two sides to this tree, right? Radicalization isn't always bad. Engagement is always bad. It's not a one-sided story. There is a positive part too here, right? So you start at the grievance. Well, the grievance may be valid, but it may be valid for different reasons. Like the world's on fire, things are expensive, stuff is hard. We get that. You work with these individuals in all circumstances and situations. They are dealing with hardship, but the source of those hardships may not be a conspiracy narrative. You may be able to show them that it's an alternative narrative, giving them a different context of, hey, just like Vanessa was talking about, how do we go about improving voting, which has an impact that will help you be better in your everyday life? That is the alternative narrative. That's what you steer them off. And to get them off toxic fixation, it's a little harder because you're higher up on the tree. You have to come back down. And if they're already radicalized, it's very difficult because you have to bring them all the way back down to the grievance and rebuild it up with an alternative narrative. So that's very difficult. This shows that it's when you want to intervene with disinformation, it's easiest when done earliest. It's easiest when you're doing it with that grievance and alternative narrative. If you can get them at that spot, you can avoid that radicalization cycle and get them on the left. And maybe this is what Vanessa was talking about. You get them engaged, right? Some of these problems are real. They're not necessarily a conspiracy narrative, but they're real problems of the social determinants and structural determinants of health. There's positive things they could be doing. They get engaged, they vote, they participate, they take action. These are positive things. I want to be clear. I'm not saying all radicalization bad or all engagement is bad, but you want to make sure they get away from this toxic sort of disinformation and get engaged. So how do you do that? You got to diagnose the germ, right? When you see disinformation, ask yourself, what grievance is it exploiting? Is it a personal grievance? Somebody who's personally experienced something, or is it vicarious on behalf of someone else? What conspiracy narrative is it providing? What are they trying to say? Who's the outgroup? Who's being targeted? Who is the target audience that they're aiming for? And think about, what is this audience considered self-similar, prestige, notoriety, or coherence? How is it spreading? Is it broadcasting, narrowcasting, parasocial relationships? What's the impact? If this goes through and people start buying this disinformation, what's the impact to the social determinants of health if this isn't addressed? Assess your options, right? First thing I always remind is ask yourself, am I safe combating in this conduct, in this medium, disinformation? Safety is circumstance matters, one size fit all. I can't tell you what it is. It's going to differ for individuals depending on where they're at. If it may be in a professional network or somewhere they're working in person or a digital scape, they have different factors. But just ask yourself, am I safe to combat this disinformation before proceeding? But should I rely on myself and my own information sources? If you share a self-similarity and prestige bias, that's a great source. You are already past those filters. You just need to be coherent and you can target it. You can reach that person. But if you don't share self-similarity or have different notoriety, if someone's following Andrew Tate, sharing Rachel Maddow or John Oliver is probably not going to reach them, right? You need to find something closer to Andrew Tate and shift them. Find someone who is in that self-similarity, but is moving them to the right. And this is where you can find allies and sources that are within their filters. Target their frame and move gradually over rather than trying to get them, with what works for you. Find what works for them and then speak in their language. Obviously assess what stage they're in. If it's grievance or conspiracy narrative, this is everyday engagement. If they're in fixation, one of the things that was so great when Tammy reached out to me, I often say, when they start getting pathologically fixated, this requires professional expertise. You have those tools. Your social workers, your caseworkers, you understand psychology, you understand difficult circumstances. This is where you have the tools to reach into this. If they're in radicalized spaces for toxic, you really do need professional help, which hopefully some of you can provide or on those pathways. But at a certain point, if they're in that really high-end toxic radical action, you got to consider safety and safety plans of how you're going to combat this. But again, this is why it's easiest when done earliest. It's easiest to engage at that grievance and conspiracy narrative and make the algorithm work for you, right? We're in this tech hell landscape where we feel like we're out of control, but the algorithm works both ways. If you can get them to click on something that's in their frame or sharing sources that they will engage in, you're going to be reprogramming their algorithm. They may not even be aware of this. This is happening. It's moving that algorithm in the social media landscape to a different area that maybe has less disinformation scripts in it. And what happens is, as it comes through, that filter catches it. And over time, they lose the fixation. They may lose some of those disinformation scripts. And they begin engaging now in a different part. And just like before, when they're engaging in a different part of this digital landscape, they may get those alternative narratives, that alternative information, and drive to the engagement, which is really where we want to get them to be. Practice makes perfect. A lot of people, you can't go out and do this just now. You practice all the time and you'll get better at it. So diagnose current events. This is something that happened just days ago. I put this in as the Francis Scott Key Bridge. I've identified, because we're tracking, all the sorts of disinformation threads. I've identified at least 8 different disinformation threads on it. At least one of them has a very clear impact to social determinants of health. So if you want to practice, take this and ask, for each disinformation you're finding, who is it targeting, right? What's the grievance it's targeting? What's the conspiracy narrative it's promoting? What would self-similar and prestige notoriety look like for this? Because it's going to be different for those 8. They're all over the map, but each one is going to have its own individual thing. And you can practice using current events, but ultimately pick your lanes. Find something in your area of structural or social determinants of health that you want to focus in. There will be disinformation that's making life more difficult for you. Learn what those are. Learn what their characteristics are. Build your portfolio of sources. So when you run into it, you have those options based on the self-similarity that you can recommend something that is a better alternative and can move them or steer them into a more healthy way. And coordinate collaborative team. Vanessa mentioned the collective action, and that is so powerful to leverage. You don't have to do this all yourself. Work together, collaborate together, bring together. And even if you're focused in your lane and there's a bunch of other lanes out there, trust that other people are working in their lanes. You don't have to do it all yourself. That way you can focus and be extremely effective in your lane with what you're doing to advance that particular aspect. Just as a quick high-level review, right? Radicalization, toxic radicalization, always begins with grievance. It is the root cause of grievance. It begins with a grievance. So understand these grievances. Social determinants of health, a lot of those are valid grievances. They are things that people get upset at, and there's good reason too. However, disinformation exploits the grievance by explaining it with a conspiracy narrative. This is where we get off track from learning about something that we may be able to positively to saying, oh, it's this group's fault, or this is because of this, and it's a conspiracy. It's based off disinformation. And it can advance toxic radicalization that really does impact social determinants of health. It can create friction with the voting efforts by creating suppression or disinterest in voting. It can also create side effects that you're going to deal with in your practices, just like the Andrew Tate example. You're going to run into those scenarios that's going to have impact on the of your clients and your professionals and your colleagues and your students. It's received through three filters. Remember: similarity, prestige, notoriety, and coherence. If you aren't in those filters, you're not being heard. So you need to understand how to manipulate those filters and make sure what you're sending reaches them where they are in that filter. Algorithms obviously accelerate this through broadcasting, narrowcasting, and parasocial relationships in the digital landscape. That's always the ever-increasing problem. But radicalization off-ramps are easiest when done earliest. If you can find, and this is when they're younger or they're starting out or they're just getting introduced, get them off that conspiracy narrative to an alternative narrative can be extremely powerful. Diagnose and assess your options for combating disinformation within their filters. Find where they are and develop your sources to target that self-similarity bias. And even if you yourself are not a good source, develop those sources that make the algorithm work for you, that as they engage and click on it is going to adjust that digital landscape and make the algorithm, this tech disaster that's going on around us, make that work for you. Practice makes perfect. Take current events and practice on them, get experience in them, but ultimately pick your lanes, develop your portfolios of sources, and coordinate, collaborate as a team. And that's, I hope this is helpful, and I'll turn it back over to Tammy. These are some of the sources, my contacts on there. If anyone has it, it's on the video. I don't need to leave it up. But I greatly appreciate the opportunity, because you really are the ones driving these changes. And I'm hoping this helps equip you do that better. And I really appreciate Vanessa for setting this up as well.
Wow. Well, thank you so much, Dr. Timothy. Really appreciate it. We are going to turn it over to Diane, who will now coordinate our Q&A. We will do Q&A until about 8:10, and then we will wrap up with some additional housekeeping pieces. And so I'm going to bring up everybody.
Thank you. We have a lot of great questions, and I think we'll start with a couple of questions for Vanessa, because they came in earliest, and people were kind of curious, as you're someone who gets involved in civic engagement, people were wondering, do you have advice for fellow social work students who are looking to get involved in civic engagement and the work that you're doing?
Yes, I do. So I'm a macro social worker, so it might come like a little bit more naturally to me, but it doesn't have to be such a huge lift to get civically engaged. I tell the story. My dad's a doctor. He's 62 years old. He just wrote his first advocacy letter on behalf of his patients. That is something simple that everybody can do. So if you have a issue that you're really, really supportive of, and you want to make that issue known to others or to your elected officials, do some letter writing. I'm from Florida. We've had a lot of policies that have passed recently that have been questionable, if we want to put it nicely. And people got together and wrote letters. So that's an easy way to get involved. As social work students, we are lucky to have LEAD, which is Legislative Education and Advocacy Day. I've been involved in those. They're really great way to get to know how the process of legislation works on a local level, because you're talking to senators and you're talking to representatives in your state. So it's a really great way to get to know that process. And what I always say is that social workers, we have expertise in areas that other people do not. And we are beneficial to the people in the elected office just as much as they are beneficial to us. So just make your voice heard by either demonstrating or writing letters, or just getting involved in LEAD, or like if you go to your NASW, they're pretty legislative involved. Things like that. And then of course, like the Healthy Democracy Campaign, getting involved in school, running campaigns for voter registration on campus and all that kind of stuff. Yeah, there's many things to do.
Thank you. And now, speaking specifically to the Vot-ER work that you're doing, after initially connecting with patients and clients, what strategies does Vot-ER have to kind of keep the momentum going and to follow up either with those particular individuals or to keep things happening in that particular organization that has used the badges and gotten people registered to vote?
So it's really going to depend on the institution's capacity. So like a major hospital is not going to have the same capacity as maybe like a shorter, or like not a shorter, a smaller community hospital or community clinic. So it's really going to depend on the capacity and what they're able to do with what they have. We have had people who utilize their text system to send out text reminding people to register to vote and reminding them of important dates. The good thing about Vote-ER is that they have a lot of organizers that are by region. So the South has an organizer, so they will be there for you if you need any help on figuring out if you want to do an event that's close by, if you want to go over conversation starters, if you're having trouble like really getting into these not deep conversations, but these conversations with people about voting, because it is scary when you first start talking about this type of stuff, because it has been somewhat politicized when it's not really political to talk about voting and getting people registered to vote. So they do have organizers that are super available for one-on-ones, emails, any of that, if you need any help. And they also have a fellowship that they run every year. Unfortunately, the applications are done for this year, but next year might be something to consider, where they offer a lot of leadership type of learning. And they also help you build a campaign at your location. So there's medical students, nurses, social workers, all those types of people learning that. Healthy Democracy Campaign, which I've talked about. And they do a lot of trainings. They're just starting to do some trainings on how to use the tools and how to use them effectively. So they have a lot of things, and they're very good at checking in with people one-on-one if they need extra help on any civic engagement event that they need to do.
And another question related to Vot-ER was, do they offer additional languages, Spanish and others, for trainings or for the badges, et cetera?
Yeah, so right now, I believe they only have English and Spanish. I know they are trying to expand it to other ones, but as of right now, I believe it's only English and Spanish. But yeah, it's definitely something they're working on, because of the populations that healthcare professionals and social workers reach are not just English speakers or Spanish speakers.
Thank you. I think we'll turn our attention a little bit to disinformation and ask Timothy a question or two. We have one from a social worker who works in an emergency department, and after being on the front lines providing crisis mental health support during the COVID time, she noticed that the misinformation related to the COVID vaccine was prominent throughout the time that she worked in the emergency department, as well as threats of violence to healthcare providers who were working with individuals with COVID. What do you think clinical social workers can do to counteract this disinformation in the healthcare setting and others?
And I really appreciate that question, because my sister's an infectious disease specialist who was right there on the front lines in Alaska throughout the entire pandemic. So I'm very familiar with this. It's one of these things where I say the easiest off ramp is the earliest, and it's unfortunate because by the time they're getting into the clinics themselves, they may have already been bought into necessarily this disinformation, because the grievances, schools are being shut down, I can't do my normal job. Those are real powerful grievance. So the level of the grievance, the shock of the grievance, sets the field for the exploitation. The higher that shock, the greater the ability to exploit it. And quickly, this disinformation came in. If you see, so obviously, hopefully this is, whether it's in our past or not is debatable from people experiencing this in healthcare. But understand when these events happen, disinformation will follow. And it's just a standard thing. And organize yourselves and work with your communities and your clinics and your areas to make sure the information goes out. I know of professionals who are out there doing lots of public speaking, public engagement. The trick is to remember that self-similarity bias and those filters. If you hit someone with a bunch of academic research and they're coming from a very different place, it may just bounce off of them. It may not reach them. You may need to reach them closer to where their self-similarity or somebody they view as celebrity or prestige bias. Use that as an ally to get closer and inside their frame. Build up to them. You don't need them to be an experts on vaccines. You need to understand this is a concern, this is a danger, and do not treat our healthcare workers bad. That's what you want at first. You can build upon that if you can get a wedge in there. So leverage your public affairs, your community. And I know there's not always easy between workers and administration and hospitals and all that, but this is where I think the unions can come in pretty powerful. Any force you can grab that will help you leverage that message, especially if it's an urgent situation where you don't have a lot of time for this. It's happening now and it's building up right now.
Thank you. I noticed myself during that that particular point in time that even the trusted public health officials and elected officials and others who customarily would be people that were listened to and attended to were not. So the disinformation was so strong in that particular issue around vaccines that I think you're correct to say that people were pretty radicalized by the time they were presenting at emergency departments and not vaccinated and with COVID.
Yep.
Can you review your definition of narrowcasting?
Sure. So take an example of formerly known as Twitter, whatever. There's broadcasting is you're putting your posts out, right? And you're just blasting it out to everyone. The algorithm's going to find people they engage. If I start commenting on your post and you reply to me, that shifts from broadcasting to narrowcasting. It's the engagement at a more narrow level. And with hashtags and algorithms and all this social media SEO, I can begin targeting you with messages that only you're going to see, people who have already interacted somewhere on my platform. And I'm creating, so instead of sending out the broad general messages, I'm narrowly making my messages to maybe you subscribe to my Patreon or you subscribe to my whatever Medium or my Substack, or I'm getting, now I've got a private channel. You're joining my Discord. Now I've got a narrow channel, but it's concentrated with people who think and feel the same way. And it's what's called the illusion of numbers. The more people in an area that think and act like you, the more you think everyone else thinks and acts like that. And therefore, if you hear someone who disagrees, you're like, well, you're the exception because everyone in my space. And that's how narrowcasting really narrows, almost like a water hose, focusing it down and getting higher force of the disinformation out.
Thank you. A little bit further along that is the kind of walk us through the steps that you've seen with the recent scapegoating of the migrants that are coming to our country and the racism and sort of disinformation related to that we've seen.
Yeah, so this is something I study extensively, and it's a version of this is known as the Great White Replacement Theory. And what those stages are, the grievance may begin with inflation is high, the economy's bad, I'm out of a job, I'm concerned with the state of the world. These are valid grievances. But what happens is someone exploits that grievance with a conspiracy narrative. And the Great White Replacement Theory is that migrants are coming in, they're non-white, so you should be scared of them because remember, we're playing on self-similarity, right? You're white, they're not, you should be afraid of them. We use all these negative attributes of them. And the conspiracy is they're replacing you. And you see it in Europe and the United States. And part of the conspiracy, it's a broad conspiracy. There's an anti-Semitic portion of it where they say the Jews are behind this. And what they do is they further this conspiracy narrative that it's not just people fleeing distressed circumstances or looking for a better life. They're now maliciously replacing your way of life. That creates fixation and people get involved in this content. They go deep. They study demographic patterns. They become fertility experts. They think about the white race as being replaced. That then leads, you can quickly see how that leads to a radical identity, what we call the warrior identity of I'm going to stop this through violence. And this is where some of my work in public mass killings, you see these arrive where these great white replacement theory contagion attacks, and you see it in New Zealand, Norway, Germany, the synagogue attacks. You saw it in Uvalde, or excuse me, Buffalo, the grocery markets in Buffalo, El Paso in Texas. They are all part of this, and they exist within this overall activity of disinformation about the fear of migrants and exploiting that sort of vicarious grievance. So it is a very dangerous one, and it is a very prevalent one right now.
Thank you. And another question is sort of related to the danger and the violence aspect of it, but thinking in terms of the role of social workers and people working, on the front lines with individuals, we play a role in intervening and potentially derailing radicalization, and you're giving us some tools to be able to do that. But what about the personal safety in that context for folks who are doing this work, noting that radicalization often can be associated with violence and with people acting on their radicalized ideas? Do you have any suggestions for how social workers could stay safe while
Yeah.
engaging in this intervention?
And I want to amplify something Vanessa said. You have tools that are special and unique, right? Not everyone has the same tools of social workers. And just like any, I work a lot with the military. Any military force, you got to protect the people with the special tools because they're rare, they're important, they're valuable. And that's why I put in that thing of always assess your situation, understand the risks. And this is personal circumstance. My personal circumstance as a white man studying this is very, very different from other personal circumstances. And it changes day in and day out. I may be comfortable doing something in a hospital or clinic where I've got surroundings versus on a street by myself and someone approaching me, or even going into a public digital forum where there's hundreds of anonymous strangers, any one of whom might cyber stalk me or something like that. So I think in general, some healthy practices are make sure that you've protected your digital footprint so that if you are engaged in this, you know what they're going to find. It's not that it's a question of if, it's just when they're going to look at your information, how they get that information. Find allies that you can work with who can speak in this, have plans, and assess your own risk. Am I comfortable doing this? I want to be very clear. I never want to put someone in a dangerous situation that makes them unsafe. So don't feel that you have to charge into a dangerous situation, but be on the lookout. You can do sensing and of observation and then bring in help and do that collaboration and coordination. There are professional resources. I know it's a fraught conversation when you bring in like law enforcement, and I don't necessarily recommend that, but bring in help that can help assess this. In all of these situations, the more people you have looking at it and thinking about it, the better it is. And sometimes if it's in the heat of the moment, I was a bouncer in the past life, right? If it's in the heat of the moment and it gets into that one confrontation, you need to protect yourself and stay safe so you can continue doing the awesome work you do, as opposed to, so, you may need to disengage in that. That's a personal choice. These are all personal choices.
Do you know of any social work community groups that are addressing disinformation that folks could join, or even maybe more broad than social work, but groups of sort of concerned citizens that are trying to get involved in some of these things?
There's a whole bunch, the social work community, that would be a great thing for a center of innovation at Boston University to take a lead on. I think that would be fantastic. But no, for the broader conversation, there's lots of groups out there. And you can find them in different things. I don't know any in the specifically the social workspace, the community. I know there are groups out there, there's all the media checks and the bias checks, but there's a lot of individuals who are doing this on their own because they're seeing, to your point, they had family members who died because they believe some disinformation about the vaccine, and they now take that as this is something. So it's more of a scattered approach right now. There's no longer that one center of truth or knowledge or things like that. You've got to, that's why I recommend focus on your lane. Pick a lane in a certain area, research who's in that space, connect them, and make power in that area. That will amplify the effects in that particular lane.
Thank you. I think we have time for maybe one more question. I'm just wondering, and this could be for both Timothy and Vanessa, what do you see as sort of a crossover with community paramedicine programs and those working on the front lines in paramedicine, paramedics, and if it can be for either one of you, but I was thinking specifically for Vanessa related to the work of Vot-ER. Are they doing anything in sort of that emergency setting like that? And then for Timothy, do you know of any opportunity to engage in that setting?
Yeah, with paramedicine, it's a little bit more difficult just because it's so urgent that we obviously don't want to like hinder or go like between like someone getting any help. But it could be more as like something that you guys do in the community, like not outside, but as paramedics, but maybe doing an event. If you guys do anything with like the fire station or anything like that, do a local event. It can be something really simple, or maybe just talking to each other, because a lot of people who are probably paramedics probably aren't registered to vote. So talking to each other, talking to your families as well, talking to your friends, just talking to as many people about voting is just as efficient as getting people registered to vote as well. So it is a little bit more difficult just because I don't know if you can even wear a badge when you're out in doing paramedical things, but those are just some ideas.
Thank you. And Timothy, I don't know if you have any thoughts on that one. It might have been more for Vot-ER.
Yeah, for Vot-ER, the broader crossover is I see these very much related, that the voting drives for social determinants of health is a forward-moving momentum initiative. The crossovers, the disinformation creates friction against that. So you think of these as opposing contested things. Anywhere you move forward, you're going to create the opportunity for conspiracy narrative disinformation to miscast what you're doing. So whenever you're doing these programs, at Vot-ER, I don't know. I'd be interested. Actually, I have a question for Nessa, whether she's run into disinformation about Vot-ER, because if you're reducing these programs, think ahead to how someone might miscast them and almost be proactive in the protection of addressing potential disinformation about, what you're trying to do. And I'll turn the time back over to Vanessa or defer to you, Diane.
Thanks.
Yeah, I think with Vot-ER specifically, I think by using the trusted messenger aspect and how it's doctors and nurses and social workers that we're hoping to be the ones to bring the information to people, therefore kind of combating it in that sense, where, hey, this person is, you would think someone would be like, hey, this person is a little bit more trustworthy than this person that I saw on Twitter or X or whatever it's called now. But personally, there hasn't been a lot. I don't think there's ever been any like misinformation about Vot-ER, but it is something that we talk about because it is, especially with the election, with all the election voter fraud talk. A lot of people have become apathetic because it's just so exhausting to even want to vote at this point. So it's just a lot of reminding about local elections and how important those are. So those are some things that we use to combat, but I haven't really ran into a lot of election fraud talk that I've had to handle.
Thank you. I think, unfortunately, we have to end it there, and there may be a couple of other questions we may ask Timothy and Vanessa to respond to after we close for the evening. But thank you so much for your time, and thanks for all the great questions from the audience, and hopefully this was helpful and informative.
I just want to add an additional thank you to Diane from BUSSW Votes, as well as Vanessa. Really appreciate your partnership in pulling this series together, from ballots to better health. Again, thank you to Dr. Timothy Clancy and Vanessa Navarro for your presentations. I think that you provided a lot of really critical information about what people need to be paying attention to, whether you're a social worker or you want to share information with your family or your clients or your friends and colleagues. So thank you for your work here. Also want to thank Mitra Sharif and Jessica Familaro, who are with the Center for Innovation in Social Work and Health, for all the work behind the scenes, pulling us together. The center is really deeply engaged in elevating the role that social workers play in health and health equity. And one of the things that we're really paying attention to is the ways that social workers can leverage our power and influence to have a real opportunity to have an impact on the agenda, the political agenda, and the policy-making agenda for health equity, both here in the country of the United States, but also globally. And this series, the From Ballots to Better Health series, is part of that effort and part of that work. You can see that we have up here on the screen for you our next session, and we will pop in the chat in a moment the registration or the information link where you can learn more about what we're going to be focusing on April 23rd, Agents of Change, Social Workers Leading the Fight Against Dark Money in Politics. This does tie very nicely to the things that both Vanessa and Dr. Timothy Clancy presented on here tonight. And then our third session, we just locked in a date, is going to be on May 1st, focused on social workers running for office and ranked choice voting. So stay tuned for more information on that. Again, we'll put information in the chat. And then our next slide, please. Please give us feedback. We would love to learn and hear from you about things that you liked about this session, things that you'd like to see for next time. And then if you are seeking CEUs, please scan the QR code or also go to the chat to fill out your post-event quiz. You have to earn a 70% or greater in order to receive the CE certificate. We will also be emailing out this information if you need to pop off right now and can't stay, so that you can be sure to get information again about your CEs and also to fill out the evaluation. We look forward to seeing you next time. We thank you again for being here to help us combat disinformation and to learn more about voting for social determinants of health. Thank you, everybody.